Welcome to day 5 of Careful Considerations, an Advent calendar for extended and dementia care planning. Today, our topic is going to be about support for caregivers. Now, caregiving is a very important process, okay? Caregiving for over a long term can be challenging, though. Caregiving support and training are essential for maintaining the well-being of both the caregiver and the person receiving the care. So we're going to talk about some sources of long-term care support, caregiver support, and training. The first one would be local aging and disability resource centers. They provide training, resources, support, access to support groups, and training programs in the local community. So we look for aging and disability resource centers. Our second one on the list is caregiver support groups. Talked about getting referred to support groups is a great place to go to go to a support group, because support groups give you not only information, but it also allows you to realize that you're not the only one going through it. You're in there with people, you're interacting with people who are going through the same thing that you are, maybe even more difficulties than you, and you can share your experiences and your insights with each other, and it certainly gives you better perspective and a feeling, not that feeling of aloneness. Home care agencies are a great resource, not only for the people that they can bring to the table, but they can also provide training for topics such as lifting techniques, medication management, and strategies for dealing with challenging behaviors. Online caregiver resources. So there are numerous online platforms that offer articles, webinars, and forums specifically designed for caregivers. Websites such as Family Caregiver Alliance, the National Alliance for Caregiving, and AARP provide valuable information and support. Speaking of organizations, groups like the Alzheimer's and Dementia Support Organizations, the Dementia Society of America, which we work with a lot, the Alzheimer's Association, Parkinson's Association. There are all kinds of support groups that help their members, and they deal with this on a day-to-day basis, and they know things that a lot of time other people will miss. They can give you support groups, education programs, and they're a resource to help caregivers understand and cope with the unique challenges that are associated with these specific conditions. Healthcare professionals are a great resource also. Physicians, nurses, other healthcare professionals can provide guidance on caregiving tasks, medical management, and available support services. They may also offer to refer caregivers to relevant training programs. Local community colleges and adult education programs. So you can go and, maybe it's not like you're taking a course there or anything necessarily, but they may have local seminars and one-day events where you can go and get some more information. Respite care services. It's very important to realize that you can't do it all alone. And especially in point where somebody needs 24-hour-a-day care. But even if you go like 8 weeks, 10 weeks, a quarter, 6 months without any time to take off and relax, and just get away from the caregiver duties, it can really wear you down. And we'll talk some more about the effects of caregiving on caregivers, especially family caregivers, in a future one of these sessions. But it's really, really, really important to get that respite care. And so there are respite care services, agencies that are out there, and you should definitely have that in part of your care plan. Government agencies at the federal, state, and local levels may offer caregiver support programs and resources. For example, the National Family Caregiver Support Program provides assistance to family caregivers through the state and local agencies. Nonprofit agencies, nonprofit organizations such as ARCH, National Respite Network, and Resource Center may offer support and training to caregivers, and these organizations often support focus on respite care and caregiver education. And we've mentioned caregiver education several times. When you start being a caregiver in long-term care, typically there's not as much to do. As somebody ages in a care situation, they tend to have more and more needs. So even if you at the beginning you were just able to take the person along with you to the grocery store or whatever else like that, and it's not necessarily going to be that in the long term. And so things are going to come up, and it's important that you have the skills to take care of the person the way that they should be taken care of, that's in care. And we keep coming back to this as a topic, but it's real important. Legal and financial counseling. Once you get in a situation, it's important to review your documents. Caregivers may benefit from legal and financial counseling services to navigate issues related to healthcare decision-making, guardianship, and financial planning. Local legal aid organizations or senior citizens may be able to provide those services, but if you already have a relationship with an attorney from your previous planning, it would be good to go back and continue there because they know your situation. One other thing that you can get, and actually some organizations or actually some employers are actually starting to offer concierge services, where they help in a caregiver situation to schedule appointments, manage caregivers coming in and out, contacting a navigator. A navigator is a person who basically is a care coordinator, a person who identifies where you're going to get the care, puts together the plan, and then hands it off to a care coordinator to then manages the day-to-day program on that. And we'll talk some more about that in a future date also. I want to thank you again for your time today, and I hope this has been useful and fruitful for you. And we will see you again tomorrow. Please have a wonderful and fruitful Advent day.